Hello everyone. Excellent evening everyone. Excellent evening to every one of us. We're all highly welcome to this evening's broadcast. Welcome, welcome, welcome to everyone. Okay, it's a new week and Easter Monday. A lot of us are on holiday. So I hope you've enjoyed this holiday. For those of us in Nigeria, I don't know outside Nigeria if they gave you public holiday for Easter Monday, but for us in Nigeria, it's a holiday. So a lot of people who would have been out there hustling, bustling, they are home, and it's so good. I hope you're refreshed. I hope you're really, really refreshed. If you are, and if you join me live this evening, just greet excellent evening so I can welcome you as we go ahead and share. I can see one or two people online already. Excellent evening to every one of us. Today, like we know, we're going to be looking at 7 symptoms of premature and early menopause and their natural remedies. And we're going to look at some researches that have been done in medicine that could help. So if you know anyone who is experiencing it or who has experienced it, especially people who, you know, they are still looking forward to having children and they've had such issues, you can call them up so that we can have some discussions. You know, sometimes when people hear good news, they are happy. Sometimes when people see that there is hope for them, they is happy. Because if somebody is hungry and you have hope that there will be food for you, you're going to be very, very excited about it. You're going to, you know, continue bearing it even if you're not getting the food right on your table. So there is hope. There is hope. All is not lost. Okay, and then everything that has a bad or negative part, there's always one good thing about it, and we're going to be looking at least one good thing about early menopause also today. So we're all highly welcome to every one of us. Kindly share. Very soon I'm going to welcome those who have greeted this evening and they are online and live with me this evening. So please, let's share. Invite others to join us as we look at premature menopause and we look at early menopause. What are the natural remedies? We're going to look at what are their causes, first of all, what are the symptoms, and then we're going to look at how do you know or that you're having early menopause, or how would your doctor actually then confirm that you're having early or premature menopause. What are some of the risks that could follow it? What are the things that will happen? You know, the negative things that will happen if you enter menopause early or prematurely, or one or two things also that are like positive about it. Like I said, it's not everything bad all through. But of course it has more of the negative issues than the positive issues. Okay, so I've just been sharing. I want to share to the last page now, and if you've not invited one person, remember that love is sharing. Make sure you at least hit that button and invite at least one person to come and join us. Even if the person is not having the issue, the person could be an instrument to further this good news and to further this knowledge that can help one person out there. Okay, so we are all highly welcome. Hello Olabisi Ibironke, you're welcome to this evening's broadcast. Welcome Chibuzo Adachuku, you're welcome to this evening's broadcast. Welcome. I really appreciate every one of us for joining us. Okay, I think these are the only two that have greeted. We'll just get going and take some more greeting. Okay, my voice is on. All right. Okay, so I can see everyone now. So we're all highly welcome. Hello Cecilia, you're welcome. Welcome Ola, CK, you're welcome. Welcome Uzomo Yemechi to this evening's broadcast. You're highly welcome. I'm so happy to have every one of us this evening. Okay, being online with us. Mind my dress hook. We're showing up their ugly faces. All right. Couldn't take it in. All right, so this evening we're looking at premature menopause and early menopause. Hello Edna, you're welcome, welcome, Uzoma, to this evening's broadcast. Premature menopause and early menopause, what can we do to make sure we avoid that? Welcome William, Charlene William, you're welcome to this evening's broadcast. So we'll just start by looking at premature menopause. The average woman goes through natural menopause in her early 50s, naturally, okay? When you're early 50s. So when we say premature menopause, then premature menopause happens to women before age 40. Remember, the normal one is from 50 and above. So when somebody happens to enter menopause at before age 40, we call it premature menopause. And when the person enters it before 45, okay, between 40 and 45, it's called early menopause. Hello Grace, you're welcome June, welcome to this evening's broadcast. So symptoms for these conditions are similar to natural menopause, okay, and the causes are often unknown. They are very nobody will say this is the specific thing that is causing it, excepting for a few cases, okay? So let's actually look in details what is real premature menopause, what is early menopause, how do you differentiate the two, and then what is primary ovarian insufficiency, okay? So when we talk about premature menopause and early menopause, there are conditions where a woman goes through menopause at an earlier age than is typically expected. All right, welcome Komolafe, welcome Maria, welcome Janet, welcome Charity. Good evening to every one of us and happy Easter once again. I hope you're enjoying your Easter holiday. So both conditions, both early or premature menopause, can result in a woman being unable to get pregnant, okay? All right, so but if there is no obvious medical or surgical cause for the premature menopause, then it is called primary ovarian insufficiency, okay? So if it's not caused by a medical cause, it's not caused by a surgical issue, then if somebody just without any cause enters premature or early menopause, the medical term for it is primary ovarian insufficiency or POI. You find them saying somebody has POI. So primary ovarian insufficiency is also refers to a premature ovarian insufficiency, okay? And the name premature ovarian failure is what they used to use before, but is no longer used because women who are told that they have early menopause can have intermittent ovulation, menstrual bleeding, or even pregnancy, okay, after being told that they have ovarian failure. So there's actually nothing like ovarian failure again. It's ovarian insufficiency, okay? And of course, we have a God in heaven. Some people have been told so many things, so many issues with them, and they didn't believe those reports and they got pregnant. And I pray for you this evening, if you're one of those who have entered early menopause or premature menopause and you're still looking for God for the fruit of the womb, I prophesy to you today that the God of heaven, the God of miracle, the God that has spare parts in heaven, he will give you your own children in the name of Jesus. Amen. And I receive it for all those who are looking for fruit of the womb that are not here with us today. So that's why I'm saying there are still good news in the corner, okay? All right, so there is nothing, I reject it, nothing like ovarian failure. And if you have insufficiency, we have a God of all sufficiencies. The God of sufficiency will provide you with that resources that you need, remove that medical condition and give you your children in the name of Jesus. Amen. All right, so what is menopause? Menopause actually is a stage in a woman's life when menstruation or menstrual cycles or period ends. And natural menopause typically happens when a woman is in her early 50s, okay? And this is normally part of the aging process. It's not a disease, and it means that a woman can no longer become pregnant once she enters menopause. She cannot naturally get pregnant, on her own, all things being equal, except when God comes. After all, God came and Sarah at 90 had her babies, okay? So we'll tell you the medical things, but there is still hope for those who believe in the God of creation, who is still in the business of creation up till now. All right, so there are 3 stages, or like 3 broad stages of menopause, because there are others. If you go and watch my video on menopause when I dealt with menopause gongo, I told other various stages, but well, the 3 main stages are perimenopause, and this is the transition phase where the ovary starts to make less hormone, causing fluctuation levels of estrogen and progesterone as well as testosterone. Okay, so it's not as if they have a steady or a normal flow or balance of these 3 hormones. There are fluctuating, rates of these hormones mentioned, and this step stops when menopause begins. Perimenopause ends the very moment that menopause begins, and menopausal symptoms tend to begin during this time of perimenopause and can actually get worse, and for some people it's actually more or worse during their perimenopause than their menopause. People vary, just like menstrual cycle varies for different people. All right, so the menopause in this stage, that's the second stage, is when a woman's period stops completely. The ovaries no longer releases egg, and estrogen level becomes very low. Once a woman has not had her period for 12 months consecutively, she has gone through menopause. I hear a lot of women telling me, I've not seen my period for 8 months, maybe it's menopause, I've not seen it for 9 months. In fact, some people for 11 months, they will see their period, but on the 12th month, it will appear. And once it appears, the cycle begins again. Even if you lived after that 12 months, you have to wait for another 12 months before you say you have entered menopause. However, it's important to ensure that the lack of periods is not due to other reasons. There are other things that could make your periods not to come, like abnormal thyroid function, okay, and also for people who are using birth control pills, this could be also the reason. Now the 3rd stage is the post-menopause, and this is the time after a woman has gone through menopause. 12 consecutive months has passed, and she now knows she's going through her menopause period. The symptoms that happens during menopause, such as hot flushes, may start to fade away during the post-menopause, but could continue for like 10 years or longer for some other women. Like I said, it's not definite, it differs from women to women, okay? And so what stage does a woman typically go through menopause? What's the normal biological scientific average age for a woman to go through menopause? Hello Janet, you're welcome. Welcome Grace, welcome Kamalafe, welcome Charity, welcome Charilyn, welcome Olasike. Now women typically go through natural menopause in their early 50s, and that's an average age of between 51 to 52, most women. But of course, some people, their own will stretch up to 54, even up to 55 and 56, but there are risks for those that stretches up to 55 to 56, but the average time is 51, 52, at most 53 if one is talking about average. Now let's look at the difference between premature menopause and early menopause. The difference between the two of premature and early menopause is actually the period it happens, when it happens. That's the main difference. So premature menopause occurs before a woman is 40, and early menopause is when a woman undergoes menopause before the age of 45. Many of the causes of premature menopause can also be the causes of early menopause. The 2 types of menopause also share many of the causes and symptoms together. Hello Iche Ifoma, you're welcome. Welcome to this evening's broadcast. So how common is premature menopause, and how common is early menopause, and how common is ovarian insufficiency? Well, they did a study and they found out that premature menopause happens to about just 1% of women under 40 years. And then early menopause occurring in women under 45 years is now increased to about 5%. So very few women would have premature menopause under 40. Of course, there are some people like that, but just 1% of the whole women in the world are 5%. So they are not really very significant. So let's look at some symptoms. What are the symptoms of early and premature menopause? Then I now tell you some scientific things and some studies that have been found out and the reasons why this is so. Hello, DCL to Thomas, you're welcome. You can ask your questions because I'm going to answer the questions as we go along, so that anytime it hits my time, 9 p.m., I'm stopping because I have other things I need to rush and go and do. All right, so women start having irregular menstrual cycles for a few years prior to their last menstrual period. So menstrual irregularity, okay? And if your cycles are irregular, you should speak to your doctor at this early age. Don't wait and say, oh, what's happening? You need to find out what the problem is. The symptoms of premature menopause and early menopause include, it's like those of real menopause. All right, it's almost like it and actually like it. Hello, Helen Ogare, you're welcome. So number one, hot flushes. That's one of the most common symptoms of menopause. Sudden warmth that spreads all over your body. Suddenly you just find yourself looking for fan to start fanning yourself when everybody is still okay. For some people, even under air conditioner or cold season, they are having the hot flushes, and then night sweat or cold flushes. In the night, somebody suddenly begins to feel cold and shivering. Is also a symptom of premature or early menopause. Or you start sweating profusely at night, and you look around, maybe you're with your husband, he's okay, everything is okay. It could also be symptoms of premature menopause. Yes, Charity, I've already talked it. It's the first stage of menopause, perimenopause, not, it's P-E-R-I, okay, perimenopause. I've already said it. Perimenopause naturally occurs between ages 45 to 50 years old, 51, okay? Some people it could stretch up to 54. Like I said, those people are having late menopause. So there's something called perimenopause. I've already talked about it. You can watch rewind later, okay? So the symptoms again could be vaginal dryness, okay, discomfort when you're having sex with your husband, and then also urinary urgency, when you want to, suddenly you're not feeling like urinating, but suddenly you start feeling like urinating, and it's as if it's going to come out. Not people that have been warned. Sometimes you feel like urinating, you will hold it. You feel like urinating again, you will hold it. I'm not talking about those people, but you just didn't feel like urinating, and then suddenly you want to urinate and the thing is almost coming out. So that's urinary urgency. A person needs to urinate, and also more frequently. Then the person is also more prone to urinary tract infections or symptoms of urinary tract infection without actually having the infection. You could just be having all those symptoms of urinary tract infection. You go for test, they say you don't have it, but still you're having those symptoms. That's also symptoms of early or pre-menopause. And then insomnia, difficulty in sleeping, sleep disorder. That's one major and common reason for early menopause and also premature menopause. Hello Ifoluwa, you're welcome. Welcome Charlotte, and welcome Ngozi Meke to this evening's broadcast. All right, some other symptoms are emotional changes, irritability, mood swings, smile, depression, worsening anxiety. Actually, there are over 34 symptoms of menopause, okay? And also there are remedies. I have a book on menopause. It's a very, 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 very good book. Not because I wrote it, but I tell you, I've sold it to quite a number of people, and they'll come back and say, oh wow, this is just, the solution to my problem. And that book usually is 2,000 naira for that book on menopause. Okay, you can chat me on my WhatsApp number. Let me put my WhatsApp number. You will have an idea of the 34 symptoms of menopause, their remedies, what their causes, and everything. It will help you, because there is no time 1 hour will be enough for one to actually talk about this. So my number is +234 703 515 1642. +234 703 515 1642 is my WhatsApp number. Okay, so you can WhatsApp me on my WhatsApp number, and then you get the book. If you're on today's broadcast, just tell me you're on today's broadcast, and I'll give you the book half the price. Okay, after that it goes back to the normal price. It's an ebook, so you can get it wherever you are. I want to pin my number now. You can get it wherever you are. Just you download it on your phone, and that's it, and you have it to check out the 34 symptoms of menopause, the remedies of those 34 symptoms of menopause. All right, so I was talking about mood, emotional changes. You're feeling sad now, you're feeling good the next moment, you're being angry with someone now, and then the next moment you're sweet. You're actually confusing the people around you, okay? Mood swings, mild depression here and here, then you're feeling anxious about issues. You could just stay and you just be feeling something is happening to one of your children somewhere. Nothing, it just pumps into your heart. These are also some of the symptoms of menopause. And then dry skin, dry eyes, dry mouth, breast tenderness, and some people will begin to even lactate, at that period. Then sometimes you're having racing heart or palpitations, headaches. They are all symptoms of menopause. And then of course joint and muscle aches and pains. That's when arthritis, diabetes, all those things begin to happen. And then reduced libido, reduce sex drive, okay? And then also difficulties in concentrating, memory lapses. You keep forgetting things that you wouldn't usually forget, and then they are temporary. You will just forget, and then the next moment you remember. You can just enter the room. What am I looking for? It's to get out of your brain what to enter the room to look for, and then suddenly after a while you will remember. These are some of the symptoms of menopause. And of course weight gain, and of course I tell us the weight gain is at peripheral. It's a visceral weight gain in the midsection of your body, and then your hair will begin to pull out more than usual, become thinner than it should be. So all these are the symptoms of menopause. And like I said, you can get the book so you can look at them and really study yourself, because knowledge is power. When you know something and know the solution for what you're going through, is going to help you a lot, okay? Knowledge is power. So let's look at the causes. What are the causes of early and premature menopause? Thank you for the thumbs up, thank you for the hearts, thank you for the love. Hello Anne, you're welcome. Anne is one of my, I just remembered, I nearly forgot. Remember that 2022 we are raising 200 maybe we'll get up to 200. Well, our target is 100 global influencers, and Anne Oviere is here with me. Anne is one of my first global influencers. She's within the first 10, okay? The list is getting more and more. When it's full, I cut the curtain. So make sure you join us. Now, who are global influencers? They are women and men who want to use their talents, their hobbies, their burdens, they are having their passions to touch the world, to influence people, to bring value to people's life. And what do? We will use a health and wellness company, because if you're healthy, you will be able to get all things, okay? And this health and wellness company is also comprising financial health, emotional health, physical health, mental health, health in total. The 8 dimensions of health, this company covers it. And that's why one of our sayings says, if it doesn't make you laugh, you change it, okay? So it's all comprehensive. We will teach you how you can touch other people's health. First of all, you have to give what you have. First of all, we'll teach you how you can stay in health, and then how you can also give other people health using our simple products. This is one of our products. Now, if someone is suffering from insomnia, if you're having sleep difficulty, this is one of the remedies. I used to have sleep difficulties. My husband will as we're gisting like this, my husband will sleep off. I will stay on that bed 2 hours, 3 hours, I have not slept. I'm still awake. Before I look at it, 2 a.m., 3 a.m., I've not slept. Then maybe when sleep will just come suddenly by 5, before you know it, 6 people are waking up. And the same thing will happen the next day. This was what helped me. This was what rescued me. I started by taking 2 baths, like 2-3 hours before I sleep. And then I now reduced it to 1. Now I sleep like a baby. I sleep and sleep and sleep and sleep. I'm no longer taking my tea, except on very days that I'm very exhausted and I want to quickly sleep off and sleep very deeply. So this will make you sleep deeply, wake up refreshed. It will arrest any form of sleep difficulties in your life. So this was what I used. So you use this product and you sell the benefits to people. and we teach you and we plug you into a system that works, the system that has worked for many people and that will still work. So I'm raising those 100 influencers, and what do? You give value to people and you put money in your pocket, okay? Because my company pays you for everyone you refer or you show the benefits of the product, and the person buys the product, the company pays you. So it's an extra income. It's a second stream, third stream, or extra income for you. And you know, the good thing about this company is that it's willable, and you do it at your own time. There are no, you know, targets per se. You set your own target. What do you want to achieve? You tell yourself what you want to achieve, and you go ahead and you achieve your target. It's a fantastic company. So I'm raising 100 people who will come and do what I'm doing. I want to duplicate myself. I am in so many, I sell in several nations of the world, right from my sitting room in a village in Ogun State. Fantastic. So I'm raising people. If you want to join us, chat me on my WhatsApp number that is there, +234 703 515 1642, and I'll be able to talk with you later. Thank you, Anne, for joining. That was what reminded me. Now, hello, Ambassador Lawani, you're welcome. Welcome, Oluchi Cordelia. Yeah, Anne says don't be left out. Come join the moving train. It's actually the moving train. Anne has plenty testimonies. And I don't know if you can come up live and share your testimony for 1 minute. Let me see. And can you request to come on live? And can you request? I'm trying to see if I'll see your request. I'll see where I can bring you to the screen. And can you request? Just request, I'll see it. And please, if you're live, just come and use 2 minutes to talk to 1 or 2 people. And is a very busy woman. She's doing this as her part-time. Okay, she's doing this business as her part-time, and she's touching life. I got to talk with Anne today, and she's so excited. She told me so many places she wants to, you know, dispatch her products to, and we're discussing. It's really interesting. So, Anne, if you could come on live, you can just request, and I'll bring you to share your testimony. At least people will see it's live. So what are the causes of premature menopause? Premature menopause can be caused by a medical condition or a treatment, a medical treatment, or it may also be for no known reason, okay, for no known cause. It could be spontaneous. It could come like that. Then possible factors that could also cause premature menopause include, like if you have a surgery and they've removed your ovaries, of course. If they've removed your ovaries, you're going to enter menopause prematurely. Or if you have been smoking. Remember when I talk about smoke, I talk about secondary smoker. If you have been smoking or you are staying near someone who has been smoking. So if you're very close to someone who smokes, please, I beg of you, make sure you leave when the person is smoking, or else you could also be at risk. And then having surgery to remove your uterus, like hysterectomy, you know, that could also cause it. Then a side effect of chemotherapy or radiation could also cause it. Or having a family history of menopause at an early age, like if your mom or your grandmom or your elder sisters had menopause at early age, that could also be a cause. Or having certain medical conditions like chromosomal abnormalities, like if you have Fragile X, that's Turner syndrome, okay, you could enter premature menopause or early menopause. Or sometimes autoimmune diseases like rheumatoid arthritis, inflammatory bowel diseases, HIV and AIDS. All this can cause premature menopause. Or also people who have some kinds of infection like mumps. Mumps can also trigger early or premature menopause. Okay, let me just explain this fully for us to understand. All right. Oh yes, Olawumi said interesting topic. Yeah, it is. And it's very important that we invite. Okay, if you've not shared to people, share and let people come and join us. It's very interesting, and it's something we actually need to let everybody know. So one of the major causes, again, let me just go in deeply, for some are genetics. Okay, if there are no obvious medical reason for you entering early menopause, then the cause is likely to be genetic. Thank you for the thumbs up. Thank you for the love. Your age at menopause onset is likely to be inherited, okay? Knowing when your parents, your mother started menopause can provide you clues about when you will start your own. So talk with your mom, talk with your elder sisters. You people should talk, gist with them, okay? If your mother started menopause early, then you're more likely than average to do the same. However, genes tell only half the story, because I'm telling you from experience, my mom entered menopause maybe like 10 years before I'm talking about mine, okay? So it doesn't really follow, it's just half the story. All right, so another major factor that could cause premature or early menopause is lifestyle factors. Some lifestyle factors may have an impact on when you begin your menopause. Like I've talked about smoking, whether you're a primary or secondary smoker, okay, it affects your estrogen and can contribute to early menopause. Smoke can reduce your estrogen, and that could lead to early menopause. Like some research was done, and they suggested that long-term or regular smokers are likely to experience menopause sooner. Women who smoke may start menopause 1 to 5 years earlier than women who do not smoke, okay? So it's very, very important for you to mind how you live your life. Hello, Osaronu, you're welcome. Welcome, Afonodare. Oh, you really love this topic. Thank you very much. Thank you. So share it with many people, okay? Dare Kikelomo, good evening, you're welcome. All right, another, when we're talking about lifestyle factors, body mass index, your BMI, can also contribute to early menopause. Like if you have low or very low BMI, you could enter menopause early, all right? Because estrogen is stored in fat tissues. Estrogen is stored in fat tissue. So when women are very thin, when you have women who have very low BMI, very thin, they have fewer estrogen stores, and then it can be depleted faster than women who have normal weight, okay? And then they enter menopause early. So some research also suggests that vegetarian diet, lack of exercise, and lack of sun exposure throughout your life can also cause an onset of early menopause. And that's why it's very, very important as for us as women, please, let's keep moving, keep activity on, keep exercising. Don't tell yourself you don't have time. Even if it's 10 minutes, 15 minutes, just make use of that time so that you can help your lifelong stage wise. All right, Chibuzo says, more grace, Mama. The topic is very interesting. Thank you, Chibuzo. Gold Onyekachi, you're welcome. Ginika, you're welcome. Ginikachi, you're welcome. Welcome to this evening's broadcast, okay? All right, so another reason, another major one I want to talk about a little more is chromosome issues. Some chromosome issues can lead to early menopause. For example, if one has Turner syndrome, also called monosomy X and gonadal digenesis, okay? This involves being born with an incomplete chromosome. It's a disease. So when one is born like that, like women with Turner syndrome have ovaries that don't function as expected, and this often will cause them to enter menopause prematurely. And then other chromosomal issues can cause early menopause too. This includes pure gonadal digenesis, a variation of Turner syndrome that could also lead to premature menopause. Hello, Hajia, Patria, you're welcome. Welcome, Victoria Dixon. Welcome to this evening's broadcast. All right, so another very interesting cause which we need to actually watch very well concerning premature menopause is autoimmune diseases, okay? Premature menopause can be a symptom of autoimmune disease such as thyroid disease, okay? And that's why it's very important for you to keep checking your thyroid. And then rheumatoid arthritis. These are autoimmune diseases. I've treated them on my page. You can just type any of these topics on my page and you will see the video that will handle them very, very intensively for you so that you can learn more about them. So in autoimmune disease, the immune system mistakes a part of your body for an invader, and then it will begin to attack it. Okay, so an inflammation caused by some of these diseases can also affect your ovaries. When you have hypothyroid or hyperthyroid, you know, you have some kind of inflammation and rheumatoid arthritis, and they can affect your ovaries, and menopause will now begin when your ovaries stop working. All right, so another thing that will bring early or premature menopause is epilepsy. Victory Dixon, you're welcome. Epilepsy, okay? Epilepsy is a seizure disorder that stems from the brain. Someone with epilepsy is more likely to experience early ovarian insufficiency, which will lead to menopause, okay? And then changing hormonal levels due to menopause can then affect the seizure in people with epilepsy also. So if we now look at the risk of premature menopause, what are the risks of premature menopause and what are the risks of primary ovarian insufficiency? Okay, so loss of estrogen at a younger age is associated with increased risk of various medical problems. When you have reduced estrogen at a very early age, like under 40, like I said, or under 45, you know, you have various neurological diseases, including increased risk of dementia, okay, loss of memory issues. You also have sexual dysfunctions. You can also have heart diseases. You can have serious mood disorders. You can have osteoporosis, okay? So other health issues that also affect women in premature menopause are like menopausal women in premature also, when the estrogen level has reduced, okay? So low levels of estrogen can lead to changes in a woman's overall health and may actually increase their risk for certain medical conditions, like I've said, like osteoporosis, ovarian cancer, colon cancer, periodontal gum disease, tooth loss, cataracts formation. So estrogen is actually one of the most important hormone in a woman's life. It's actually like the woman itself, okay? But however, compared with women who go through natural menopause, women undergoing premature menopause spend a greater portion of their lives without this protective benefit of their own estrogen. So because the estrogen level reduces on time and early in life, they are prone to some of these diseases I've mentioned. So this put them in a greater risk of all these diseases that, you know, I have told us about. Yes, Hajia is asking, can ovarian cyst cause early menopause? Anything that has to hamper your ovaries can cause early menopause. You know, some people say because they are having issues with ovarian cysts, fibroid and things like that, they could easily enter menopause on time, early menopause. And some people, it could be elongated one. Remember, it's not really certain for people. It just depends on the way your body reacts to it. So any medical condition you're having, is better for you to check out yourself on time. So how do they diagnose people with premature menopause or early menopause? If you begin to have symptoms of menopause before the age 40, your health care provider will need to do several tests and also ask you so many questions to find out if you're going through it or if you're very close to it. You know, they can ask you question about your periods. How does your period come? Do you know the dates of your periods? And, you know, ask you when last it came and the behavior. And then also they will discuss your family history with you. When did your mother enter menopause? When did your father, when did your elder sister, if you have any, enter menopause? They are also going to ask you some of those questions. Then they will test your hormone levels. They will test your estrogen level and also test your gonadotrophin level, okay? Then looking at other medical conditions that may contribute to your symptoms, okay? They will ask you, how do you have thyroid? How is your blood sugar? They're going to do all those tests, you know, on you to find out to be sure what is causing it, and then check if you have rheumatoid arthritis and things like that. So women who have not had any menstrual period for 12 consecutive months 12 stretch months at a stretch, and they are not having any medical condition, you know, which could have stopped that menstruation, then they must have entered their menopause. So how do you manage this condition? That's what we want to discuss now. Hello Grace, you're welcome. Welcome to this evening's broadcast. So management of the condition can vary depending on why menopause started earlier than normal. Given the health risk associated with early menopause, hormone replacement therapy (HRT) is routinely recommended to all women with premature menopause or primary ovarian insufficiency, unless there is a compelling reason it can be used. But of course, you know, there is a lot of confusion about the safety of hormone therapies. Many of the risks of hormone therapy used after natural menopause are not thought to apply to women who are on premature menopause. So it just depends on, it's important for you to know the advantages and the disadvantages and discuss with your doctors before you go onto any medical, you know, line concerning that. So now let's go to the cocoa of the matter. What are the lifestyle and home remedies? Okay, although you can't prevent menopause, remember I told you it's a natural thing, especially if it comes to you naturally. You know, you can't actually prevent it from happening, but you can take action that can stop the symptoms. All right, because the symptoms, if not treated, if not handled, can lead to secondary diseases. So number one, your food is very important, and that's why in Aging with Grace we don't joke with our diet, we don't joke with our menu. I keep saying it all the time, and every Wednesday I go on live to tell you what you can do. Join me again on Wednesday so that we can look at the food you can eat during menopause. Okay, all right. Then exercise is very, very important, and that's why on Saturdays I bring out time to teach us on exercise and actually go through it with us. Exercise is also very, very important in regulating the time and onset of your menopause. Then if you smoke, consider quitting it. Okay, that's another lifestyle change you can do, but I particularly prefer using vitamins and herbal supplements, you know, over conventional medications because of the side effects that come with all this. So there are some supplements that can actually help you if you're going through premature or early menopause. The first one is our also important Forever Vitalize Women. This supplement I'm holding in my hand is like a miracle for those who are going through hot flushes, those who are going through night sweats, those who are going through some of these issues we've mentioned as symptoms of menopause. Primarily, every woman should have Vitalize Women. Have Vitalize Women. If you use it for 3 consecutive months, you will pray for me. You will be among those ones that will call me every morning and they pray for me. I forgot to export somebody's prayer that I wanted to make us listen to my other phone, so you can listen to it. Maybe I will do that on Wednesday. So Vitalize Women is the base for every menopausal issue. Okay, and then if you're having insomnia, you will add your royal jelly and your blossom tea. If you're having insomnia, okay, you add your royal jelly and your blossom tea. If you're having, oh my goodness, these people know. See, they have taken my light too. And I'm going to continue this, and I can't even call this guy. So if you're having kind of depression, if depression is what you're having, you will need to get our royal jelly. You will need to get our royal jelly. You will need to get our nature me. You will need to get our B12. And if you're having hot flushes and the rest, you also need to get these products that can help you, you know, with the diseases you're having. I'm sorry this is going on. I don't know why they bumped me off, you know, today. I forgot to call them. And I have other very important topics I need to handle now. You will just please stay tuned. Give me 1 second to make sure I call on them to put on this light, and then we get going. Just 1 minute, it won't be more than that. Thank you for staying put. I'm so sorry for this. These people, eh? It is well. We will continue. And so many people stay put to the end. God bless you all for staying. All right, so I was trying to say that I prefer natural ways to attacking these things because of side effects of drugs and side effects of I just said off Nepa. Off Nepa I did for where I told you I stay in a village. Which kind Nepa? It's not Nepa. I stay in the village and I'm reaching the world from my village house. So most times we provide our own electricity. It's not NEPA. Which kind NEPA? It's my security guard. In fact, when I'm through, we began figure it out together. It's me and him today. In this house, I have how many gens? 1, 2, 3, 4, 5. I have 5 generators in this house. So I have the big one, diesel. I have 2 diesel generators. I have 3 petrol generators. So one has been on since morning. In the afternoon, they put it off and put on this one that went off now. And I warned them. I said, you know what? When it's 5 p.m., please put off whichever one you're using and put on the one I'll use for my broadcast. But trust them now. They didn't do it. And I was just telling myself when it was 7, these people didn't put off this gen since morning. Hey, I don't know what their plans are. And I said when I finish having my bath and come out that I'll tell them, oh yeah, switch on to another one. I forgot. So it's not Nepal. God will help Nigeria. I pray for Nigeria that a time will come, you and I will see it, when all these things will stop. Niger Republic there, you will not see this happening, okay? I've lived in this house for like 20 years and imagine that I buy diesel and petrol every day. Imagine. So you can just imagine what happens. The NEPA we have comes maybe once every 3 days and they give us like 6 hours. And of course, you know, so many times they don't bring it. God heal Nigeria in Jesus' name. Amen. Hajia. So it's not it's not up Nepal. God will help us. All right. So if it doesn't make you happy, change it. Nobody actually will make me unhappy. That's me for you. Sometimes my husband will tell you, oh, that this situation, you're laughing. I said, that's me. Oh. I'm always happy. I'm always laughing. Whether good or bad, all will be well. All will be well. All right, so let's go back. I'm saying that I prefer natural means, natural ways of handling premature and early menopause. Okay, so exercising. Remember, I always tell us there are 4 major things you need to look at: exercise, diet, supplementation, and lifestyle change. And these are some of the things I've mentioned here. Stop smoking, do your exercise, walk about, watch your food. On Wednesday, join me. We're going to be cooking one recipe for menopause on Wednesday. And then I now said that I, for one, I've seen a lot of miracles from supplementation, and that's what I use. Now, there are 3 basic supplements you should have. Or let me even say 1. If you tell me which one, if it's only 1, Vitalize Women, okay? But if you now want to keep looking younger, oh yeah, you will add your royal jelly, okay? If you want to keep looking younger, you add your royal jelly. And then if you now tell yourself, okay, I want an anti-wrinkle supplement that can help me as I'm looking younger so that I'll be smooth and supple, I will tell you to take your Infinite Feminine Complex. And then if you want to be who you are, whom you're supposed to be, let me say who you're supposed to be, on bed, good libido, enjoying your sex even at menopausal stage, then you now add this. So these are the 4 I always advertise, and I'm doing promo on them year in, year out on these ones because I want women to be happy. And I have a lot of testimonies on these 4 that I'm raising here. So you can chat me on my WhatsApp number that is on the screen, +234 703 515 1642, so that you can get the discount and get this for yourself. Now, but if you're having insomnia, like I said, if it's insomnia you're having, then blossom tea and your royal jelly, the two that you will actually need, okay? And then you can actually also add nature mint to control your minerals, but these two are the basic ones for if you're having insomnia, sleep disorder, it will actually stop it. And then if it's depression, if you're going through depression, anxiety, mood changes, then you could take your these three: royal jelly, B12 and nature mint. I don't joke with these ones. This my what is it called, my B12. Incidentally, I love my B12 because it's very nice and sweet and succulent. I've not taken it today, so I'll take my B12. You just chew two, very nice. Okay, I take it because it also has this B12 plus. It has with folic acid, and those of us who need to have steady blood, because during your menopause you can also have blood issues. So these three will do for depression. Okay, hot flashes, I've already showed us those basic ones. Night sweats, those basic for or vitalized women can also help you. So can early menopause be reversed? For now, available treatments can help delay or reduce the symptoms of menopause, but there are no sure way to reverse early menopause. However, researchers are investigating new ways to help people with menopause to have children. That's the good news I'm talking about medicine. People that are still under menopause now, there are scientific ways that they can still have children. Like for example, in 2016, scientists in Greece announced a new treatment that enabled them to restore menstruation and retrieve eggs from a small group of women who were in their perimenopause. This treatment made headlines in as a way to reverse menopause, but little is known about how well it works. The scientists reported treating about 30 women between ages 46 to 49 by injecting platelets-rich plasma RIP into their ovaries. Okay, and PRP is sometimes used to promote tissue healing, but the treatment hasn't been proven to be effective for any purpose. It's just still under investigation. Yes, Hajia is asking, can I ship outside? Yes, Hajia, where? Tell me where the nation is. I supply everywhere. Sometimes I wouldn't need to ship. Sometimes I will need to get it from that nation, okay? So, Hajia, just chat me on my WhatsApp number, or you tell me where the nation is here. I can answer you straight away. Thank you for asking. All right. Oh, Victoria said very interesting. Yes, thank you. All right. So, the scientists that did that research claimed the treatment worked for like 20 out of the 30 women, okay? But however, research still criticized them that it wasn't they didn't use very large number of women, and they can't really trust it. Of course, research. Well, let me tell you, when somebody is looking for babies it's better to try as much as your heart and your spirit tells you to try, because you don't know which one will enter. So though the research might have potential for the future, it's not a realistic treatment right now. Okay, it's not a very realistic treatment right now. All right, so infertility is often a big concern when you start your menopause 10 years earlier, yet there are no other health concerns. So it's if you haven't had your children, that's where you should be concerned. But if you finish having your children and you have early menopause, you shouldn't really matter. Just go on your good supplements, okay? Like your vitalized women, like your multi-maca, like your royal jelly. If you have early menopause and you finish having your children, there's nothing to worry about. If you're having premature menopause, early menopause, and you finish having your children, just go on this free. If you can afford it. If you can't afford it, you can go on any of these two. You're sure to be okay. All right, so a steady stream of estrogen to your tissue has many issues. Estrogen, like I said, is one of the power hormones for women. For example, when you have good level of estrogen, okay, you will have good high density lipoprotein, which is the good cholesterol, and then it will also help to decrease the bad density lipoprotein, which is the bad cholesterol, the LDL. The HDL will increase, the LDL will reduce if you have good estrogen level. Again, another thing that good estrogen level will do for you is that it will relax your blood vessels, okay, and then prevent them from getting together to allow the blood flow, and also it will prevent your bones from thinning, okay. If you have good estrogen level, it will prevent your bones from thinning out. And that's why for women who enter perimenopause and menopause early, I always recommend our calcium. Our calcium will help with sustaining good bone density. It will help to sustain good bone density for them, okay. So then losing estrogen early, you know, we increase the risk of many diseases, like I said before. If you enter premature menopause or early menopause and you're not taking some kind of natural things to help you, you might develop heart disease. You are at risk of developing heart diseases, osteoporosis, depression, dementia, even premature death. So that's why I say if you've entered menopause early, there's nothing to worry if you've had your children, but please stay on supplements. Supplements are very, very important if you've entered menopause early. I'm begging you. Don't say I'm well now and I'm okay now. Remember, you have a long stretch of years to go without estrogen at the normal level. You're going to have a long stretch of life to go having imbalance in your hormonal level. So it's very, very important for you to be on some kind of supplements that can help you. So if you have concerns about these symptoms, you can talk with me. I've already put my number on the screen for you, +234 703 515 1642. And one thing about me, I answer every WhatsApp, okay? Any WhatsApp you tell me, no matter how long it is, I will answer you. So make sure that you chat me. If you're going through early menopause or premature menopause, please chat me. And don't say, oh, I don't have money. We women, we need to take care of ourselves now. If you don't take care of yourselves now, when would you? This money you're using, you're making, and you're not taking care of your body now, when you're old, you will use it to start treating illnesses. Remember, if I say take your calcium now, so that you can have enough vitamin D, and that's one important thing about our calcium, it has vitamin D, because you need vitamin D to be able to digest your calcium if you're taking calcium tablets, okay? So you need this calcium. If you're going through perimenopause or premature menopause early, or even at the normal stage, you need these supplements. They will help you to be what you're supposed to be. So can early menopause protect you from other conditions? That's another area I said we should look at. Starting menopause early has an advantage, okay? Actually, it can protect you from other diseases like estrogen sensitive cancer, such as breast cancer. Now, breast cancer is one estrogen sensitive cancer. What does it mean? If you have high level of estrogen, okay? If you have high level of estrogen, or if you don't enter menopause at the right time, if you have late menopause, you're more likely to have breast cancer. So that's the one advantage of early menopause, okay? So people who enter menopause late, after like age 55, are at a higher risk of breast cancer than those who enter at the normal life. This is because their breast tissue is exposed to estrogen for a longer time. So easing the transition to menopause, how do you do that? A genetic test may one day determine a person's likelihood for early menopause, but none is known for now. So there are many fertility options. Let me end with that, which is an advice I also want to give to us. If you've entered perimenopause, your menopause on time, premature or early menopause, there are very, things you can do, many things you can do, especially if you're interested in having children, in still having children. There are options you can take for fertility. Number one is adoption. I know that some tribes and some people feel, why should I go and take another person's child? Now, you know how I look at it. I call it whilst thou dog not. I've seen many people who were trained, that were adopted, and those children are lovely children you will not even know. So if adoption is one thing you can do, please go ahead and do it. Think about it, discuss with your husband, and know how to go about it. I've seen many homes that are adopted and they are living happily and they are okay. And then another method you could use is receiving an egg donor. Okay, you can have, if you're still, they watch your doctors do test on you and they feel you could still carry a pregnancy, it's okay if you get egg from somewhere. The person is not known, you don't have to broadcast it to anybody, nobody knows. You know, you and your husband can decide that and you go and do it. And you know, you need to talk to yourself, have some confessions on yourself that you make to tell yourself that you're okay and it's okay. All right. And then also having a surrogate carry your child. You can have a surrogate parent, it's still okay. A fertility specialist may also suggest procedures that can help you have children. So it's good for you to go to a good hospital and make sure, especially what I always tell people, make sure there is testimony, somebody that has given testimony or they have testimonies. Okay, you talk with your doctor about the options that are available for becoming a parent. You know, their risk and successes can be affected by many factors, including your age and your overall health. And that still brings me back to supplements. I know a woman that was going for IVF and she had done like 3 and it failed. So she came across our product and she asked me, she said, what product do you think I can use that can help prepare me better? I know I've been taking some of these drugs, but I have a feeling. That's another thing. What are you having feeling for? Whatever feeling you're having, don't kill it. Take it, okay? So she told me that she said she's having a feeling about that our products can help her. I don't know if I have that product here. So yes, okay, thank God. I gave her our Pomestine. I didn't even know it's on my table. I love this drink. It's an antioxidant. I gave her our Pomestine, our Vitalize Women. These 2 products, she took it. She just took it. She was just asking for natural supplements she could use. So I just told her, I just gave her this one. I dashed her the day she came to me. I didn't even give her that she should use. But I know it helps with people who have ovarian cysts, people who are going through menstrual problem, people who are having one kind of, you know, all those abdominal pain. So I just gave her. But I just told her, make Vitalize Women your dietary supplement, and then multi-marker, because she has come up of age, so that she can enjoy her sex with her husband. I also told her to get this for her husband to boost the sperm of her husband. So she just took this for like 3-4 months and went for the next IVF, and for the first time she took him, that IVF worked, and the baby was growing. So when we talk about all these things, it's always good for you to, I call it, cast your bread upon many waters, because you don't know what will happen. So let me answer this question. Can I still get pregnant after being diagnosed with premature menopause, early menopause, or primary ovarian insufficiencies? Unless the ovaries have been surgically removed, it can be difficult to diagnose a woman younger than age 45 with menopause, okay, as opposed to primary ovarian insufficiency. Women with POI, that's primary ovarian insufficiency, can have intermittent ovulation. They can have intermittent ovulation, and that's why you shouldn't give up, because you don't know when that ovulation will happen. Please, 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 if you're having premature menopause or early menopause, make sure you continue meeting with your husband. Make sure you continue having sex with your husband, and make sure he too is also making sure he's eating healthy. Multi-marker can help him. It's both for men and women. Let him take his multi-marker. You people should continue meeting, continue praying, because you don't know when that will happen, because you're still having some kind of ovulation, okay? You have intermittent ovulation, and which may or may not be accompanied by a menstrual bleeding. You might even have that ovulation and you will not have periods, okay? You won't have your bleeding coming up. So other women may be able to get pregnant either through IVF or egg donor, like I said. So it's important for you to work with a fertility expert to explore the options that are okay for you. Options available to you will vary depending on whether you have interest in having children in the future or children now, or what type of option you will want to see. In some cases, fertility may be restored and pregnancy could be possible. Hallelujah. And I pray that for you today, that if you are going through early menopause, premature menopause, and you still want to have children, I prophesy to you that God will answer you in the name of Jesus, and you will have those children in Jesus' name. There are also other means that are like assisted reproductive technology, including the IVF that I talked about could be considered. And if you do not want to get pregnant while on hormone replacement therapy, your doctor will also tell you what to do. So you need to talk. Let's not keep quiet. Okay, Chibuso is asking, let me see. Let me just take our questions, and then our questions that we have asked, and then we call it a day, because I think I've overstayed by 8 minutes because of the light that went off. So I'll take our questions now, and then we call it a day. Okay, can I ship outside? Yes, I've answered you, Haji. I can ship outside. Chibuzo said yes now. A lot of people here have received products in Lebanon, Italy, US, UK, and the rest. Okay. Victoria said, wow, interesting. Thank you. Any supplement for high blood pressure? Yes, we have supplements for high blood pressure. Me and Ginika are still on our me and Ginika on chew your Actis. Actis is one of the supplements for high blood pressure. I chew it. Okay. She was also Ginika told me to be chewing it. So this is one of our supplements for high blood pressure. Then garlic thyme. I don't have garlic thyme here, do I? No, I don't. Okay, and then cardio health, and of course our popular aloe vera gel. Aloe vera gel should be behind me. It's also for high blood pressure. Oh, Indian. Okay, Hajia, can you chat me? Chat me on my WhatsApp number. I'll give you the procedure for you to get our products in India, okay? We have our product center in India, so you can get our products in India. Esther said, which of the supplements that can one take care of blood clotting? Esther, the person should chew this thing 333. Okay, but also chat me on my WhatsApp number, so I'll be able to. Esther, chat me on my WhatsApp number so we can be able to discuss that. Ndidi say, can you ship to Belgium? Yes, Ndidi. I have a downline, one of the 100 influencers, Jennifer. Jennifer is in Italy and she helps me with European countries, okay? So Ndidi, chat me on my WhatsApp number. You can get it within 3 days in Belgium. Adelanke is asking how much. I can't say how much. You see somebody asking me from India, from Belgium. So chat me on my WhatsApp number. Let me know which country you're calling in from, and be able to tell you how much you can get it in that country, okay? Adelanke Adesoya, I'm answering you. So chat me, please. Adelanke, make sure you chat me and tell me you are on broadcast today, and I'm going to give you some discounts, okay? Good evening, Olusheyi Kate. NK was from Kaduna Live. God bless you. Yes, Chibu's arthritis, rheumatoid arthritis can cause early menopause, okay? I've said it before. If you're having rheumatoid arthritis, it's an autoimmune disease and it can cause early menopause. NK Wax, what are you asking? She says, Ma, can one take calcium and nature mint together? No, don't take calcium and nature mint together. What I do is, if I'm taking nature mint now, I won't take calcium until I finish my nature mint, then I can continue with my calcium. Okay, so you just take one, don't take the two together. Then it says in your video you chew nature mint. In fact, I have nature mint here. Let me chew my nature mint. I just finished chewing Actisio. See my nature mint, yeah? I love it. If I tell you the story of this nature mint, I chew it. I chew many of our supplements. You saw me chewing B12 earlier, and then I just chewed Actisio. And I put nature mint in my mouth again. I love this supplement because there is this making me look younger, healthy, no sickness. Can you imagine? For 6 years now, I've not gone to the hospital. This was me every month. Without exaggeration, I can tell you my hospital. You can go and check out. Mother and Child Hospital. You can go and check out. It's in Lagos. I used to visit the hospital every month for malaria or ulcer or high blood pressure, one issue or the other, but mainly malaria every month. For the first time for 1 year, I didn't go to the hospital. They called me from the hospital. What's happening? I said, nothing though. God is keeping me in health. It's not that I changed hospital. I've not gone any. The third year they called again. After that they didn't call. And from then up till now I'm with you. No more hospital. Why? Because I'm using these supplements that are natural, 100% organic. Not only am I using them and I'm having health with me and my family, I'm also putting money inside my pocket, getting richer and richer by using this product. Fantastic company. And that's why I'm raising 100 women and men who will come, use this product, enjoy this product. Don't say you don't like supplements. If you don't like supplements, we have body care. This is conditioner. You say you don't like hair, we have body soap, okay, that you can use for your body. You say it's only whatever fashion, and we have everything. Come and use these products. Use them. Be healthy. Become a global influencer. I'll teach you how you can reach the whole world. You see somebody calling me from India, from Belgium. I have a downline in Italy. I have downlines in America. I have a downline in UK. I have a downline in South Africa. I have a downline in Zimbabwe. I have in Malawi. I have in Ghana. Okay, so these are people all over that I have never seen myself. I've not touched them because it was during COVID that I got in contact with them. Between now, backward to COVID. All right, so come, and I'll teach you how to touch lives all over the world. Come, and I'll teach you how to get good health. Come, and I'll teach you how to make money and put money in your pockets, okay? All right. Thank you, Ndidi. Say thank you. Thank you also, Ndidi. Yeah, Lillian, I just answered. We have supplements for blood pressure. I have only 2 of them outside here, which I'm going to show you, but there are many others, okay? Because I wasn't treating blood pressure. I said number 1 is your aloe vera gel, your Active C, your garlic thyme, and cardio health. Cardio health is very, very important. Whether you want it for management or for prevention, they are very, very good for you. Ginika is here. Ginika say choo. It's very sweet. I'm telling you, Ginika, I've been enjoying this. If you see what you have done for me, because sometimes when I take Active C after food, especially in the night, I will have one kind of it. I will still be perceiving the order after some time. But this way you have taught me to chew it. As I just chew it, I'm okay, you know. So I've been taking my Active C normally. Thank you, Ginika. I've learned that one from one of my 100 influencers. Ginika is one of my 100 influencers in Asaba. All right. Mary says, please, how much is the high blood pressure? You are in Abuja. Mary or Mota, just chat me now, okay? My WhatsApp number, chat me now. I'm going to tell you the price, and you can get it in Abuja tomorrow. Dispatch rider will bring it for you, and I'll give you at 20% discount for saying it here. So all those who have asked questions, if you're going to buy the product, you're getting it at 20% discounts for talking here in the broadcast. And if you were in broadcast for me today and you stay in Abuja, or you stay in Enugu, or you stay in Benin, or you stay in Port Harcourt, or Lagos, or Ibadan, I'll also do free delivery for you if you're buying the menopause or high blood pressure. These are the 2 I've been asked of today. Menopause or high blood pressure only. I'll give it to you at 20% discount, and I'll give you free delivery to these 6 cities I've mentioned, not others, because they are the ones that talked. It's Abuja person that talked. All right. Yes, Chineye, we have for diabetes. We have supplements for managing diabetes. You can also chat me on my WhatsApp number, okay? And you can get it. Olusheyi say, how can I be your downliner? Very simple. Just chat me on my WhatsApp number. Very, very simple. Very, very simple. I will put you in for the global influencer immediately, okay? So if you want to be my downline, you want to become a forever distributor, chat me on my WhatsApp number. You want to become one of the 100 influencers, global influencers, chat me on my WhatsApp number and you can get it. Oh yes, Immaculate, I'm chewing my B-pollen. Yes, B-pollen is lovely, 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 lovely. I chew B-pollen also. Wow. So thank you very much. I think we have overstayed by 18 minutes because of the time we had and all the questions we're answering, and so many people are still online. I wish I can continue. But if you continue asking questions, I will stay. But anyway, we need to go so that some people that are talking data can go. Okay, somebody is asking, what about from Delta? Cause I'm jealous. Victoria, okay, if you can, if it's Asaba, I can deliver to you at Asaba for free. If you're buying the menopause set, or you're buying the complete set, or you're buying the high blood pressure set, or you're buying the diabetes set, if you're buying the full set, I'm going to give you the full set at 20% discount, and I'll still do free delivery if you're live with me. So chat me now. If you watch the replay, please, it's not though. So you have to chat me now. I'm sure if you're live, you should be able to chat me within the next 20-30 minutes. After 30 minutes, it's no more binding. It's no more binding for me. Thank you, Remy is thanking me. Thank you, Remy. Remy is also one of my 100 influencers and my downliner. She just joined. She's actually starting her training this week, okay? And I pray for you, Remy, that you will do better than me. That's what I'm praying for all of you. Ginika is in Asaba, Remy is in Abuja, and is in Lagos. I'm praying for you people that you all do better than me in Jesus' name. Amen. How can I get it? I'm in Cairo, Egypt. Just chat me on my WhatsApp number. You will get it in Cairo, Egypt, okay? We have an office in Egypt. You'll be able to get it in Cairo, Egypt. I'm going to give you the procedure of how you can buy in Cairo, Egypt. And if you want to be my downliner, you can also be my downliner in Egypt. I'm going to tell you how you can get it. So Victoria, where are you in Delta? Warri, Asaba, or where? Tell me, let me know. Victoria, for asking me, just chat me on my WhatsApp number. I also deliver free to you if you're buying the complete set. No matter where you are in Delta, I'll deliver it free for you, okay? She said, good evening, your teaching is very interesting. Thank you, Chi. I appreciate. I will chat you tomorrow. I will need premature menopause. Okay, God bless you, Chi. Chat me tomorrow, no problem. It's fine. Oh, why Immaculate? I have downlines in UK, okay? UK is very, very easy for me to deliver. 2 to 3 days, you will get your product in UK. All right, so you can chat me also on my WhatsApp number that is print +234 7035 151 Oh yeah, Chineye, interesting. All right, thank you. I hope I answered everybody's question. Let nobody come to tell me, mommy, you didn't answer my question. This thing is not showing me everything. I hope I did. I just hope I did. I think I tried to get everybody's question. I hope I did. All right, thank you all for joining me. I feel like I shouldn't go. But I have to hit this finish button now. All right, I love you all. On Wednesday, we are going to cook. We're going to cook a food that can help with early or premature menopause. You know, we're talking about natural meat. So we're going to show you a food you should always add to your menu each time, so that it can help you. Thank you, Gold. Gold said interesting lesson. Thanks a lot. Love you all. Bye.